Okay, so you're here for another deep dive with us, and today we're going to be looking at the healthcare landscape.
Yeah.
And we're going to be focusing in on one particular company that is making a lot of waves in the area of in-home care and palliative care and also hospice services.
Right.
And that company is SilverStone Health.
Okay.
And so we have a really interesting set of materials here that we're going to be working with today.
Yeah, it looks like we've got news articles that have been tracking their growth. We've also got some press releases kind of marking some of the key developments for them.
Right.
And then even some blog posts that are directly.
More importantly, we want to sort of understand what their approach reveals about, the larger changes that are happening in end-of-life care and in post-hospital support as well.
It seems like they're right on the cutting edge of these changes in the healthcare space. So
Absolutely, yeah.
if we could understand their approach, we've basically got a shortcut to understanding kind of what's going on more broadly so.
Right, exactly. And I mean, it all starts with this guy, Alfonso Montiel,
Right.
who started this company. And
His background is super interesting. He didn't actually start in healthcare, did he?
not at all, no. He
Okay.
actually founded a $150 million private equity hedge fund.
Wow.
And also, helped develop strategies for several Fortune 500 companies.
Okay.
And he also was the CEO for a company called the Lemon Tree Trust, which is actually this really fascinating charity that is focused on gardening in refugee camps.
Interesting. What a diverse set of experiences.
Yeah, and he's also got a law degree and an MBA from Columbia.
Okay.
So he's a pretty sharp guy.
Bringing a lot to the table.
Yeah.
So what was it then that led him into healthcare? I mean, specifically this area of end-of-life care.
Well, it seems like a real defining experience for him was
Okay.
volunteering in a hospice after a close relative of his passed away. And he started to really, care for people who were in the final stages of their life.
Okay.
And it seems like through that experience, he really got a profound understanding of the potential for connection and purpose in end-of-life care. And he became very convinced
Right.
that for many terminally ill patients, the home environment offered significant advantages
Oh, yeah.
over a hospital setting.
Interesting.
Yeah.
And so that conviction that he got there led to some pretty concrete action, huh?
It did, yeah. So in November of 2020, he actually acquired Comfort Care Hospice,
Okay.
which was a provider already established in the Dallas-Fort Worth area,
Got it.
and then quickly rebranded it as SilverStone Hospice.
Yeah.
And that wasn't just,
Range change.
a cosmetic change. It really signaled these ambitious plans to expand their offerings. And he actually anticipated at that time that they were going to introduce home health and palliative care service lines
All right. Cut.
pretty quickly.
So it seems like they had a broader vision right from the start,
Right.
beyond just hospice services.
Exactly, yeah.
What were some of the motivations for that? I mean,
Yeah.
what did he see in this approach?
Well, he noticed some pretty big gaps in the quality of care that was being delivered and recognized that there was a growing need
Okay.
for high-quality end-of-life services. And he was really motivated to support families who were going through these incredibly challenging times.
Yeah.
He felt like people were sometimes being kept in acute care facilities
Okay.
for longer than they needed to be
Mm.
because of things like delayed referrals from physicians and
Mhm.
and also just people not really understanding the benefits of hospice care.
Right.
And sometimes even cultural factors
Yeah.
preventing people from
Interesting.
choosing hospice care.
So helping families through that process,
Yeah.
sort of demystifying it.
Right, exactly.
Yeah.
And he even said this very specific thing he said.
Okay.
I like to say that we work with the living, not the dying.
Hmm.
And his point was that, hospice care, when it's initiated early enough in a patient's diagnosis,
Okay.
has actually been shown to extend life in some cases.
Oh, wow.
Because people actually tend to receive more tailored and focused care.
Interesting.
And he even said, we're seeing that at SilverStone already. We're seeing instances where early hospice intervention is making a tangible difference.
Okay.
Yeah.
So let's drill down on that a little bit more and talk about, SilverStone Health's growth and the vision for the company.
Okay.
We know that they started with acquiring Comfort Care Hospice back in 2020.
Right.
But what's the landscape look like now? How much have they grown?
Oh, it's been pretty remarkable. So by June of 2024, so less than 4 years later,
Okay.
they were reportedly serving several thousand patients on a daily basis. Yeah, and one article from October 2022 highlighted this astonishing 700% growth rate
Wow.
during the pandemic.
Huge.
Yeah, and another source said that their annual revenue increased 15-fold
Okay.
in that same approximate 4-year period.
Wow.
So we're not talking about steady growth. We're talking about a transformation here.
Yeah, that's a major, that's a major
Yeah.
expansion, and it really speaks to the fact that they are addressing some kind of unmet need
Right.
that's out there.
Yeah.
So what is it about Montiel's vision then that is driving this?
Well, he really wants to establish a truly integrated and seamless system of home-based healthcare services. He
Okay.
doesn't want people, patients and their families to feel like they're lost and alone
Right.
as they're trying to navigate the oftentimes very complex healthcare system.
Mhm.
And that vision has really resulted in this comprehensive suite of services that are now offered under the SilverStone Health umbrella.
Okay.
So they're offering home health, palliative care, hospice specialty physician services, telemedicine, wound care, and even professional home assistance.
It's like a one-stop shop
It is.
for all of these needs.
And it's not just confined to private residences.
Right.
It's also delivered in nursing facilities, rehabilitation centers, senior living communities.
So they're really meeting patients where they are.
They are, yeah.
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 Now, one phrase that comes up a lot in our sources is this revolutionary physician-led model.
Right.
So what's significant about that? Why are they emphasizing that?
Well, they've really intentionally designed their system to address those gaps that often exist in traditional healthcare delivery models.
Okay.
And Montiel is incredibly confident in the efficiency of their model.
Okay.
He actually claims that their competitors require, on average, 10 locations
Wow.
to achieve the same revenue and EBITDA as just one SilverStone location.
So it sounds like they're doing more with less.
They are, and he goes on to say that by next year, a single SilverStone location will be as productive as 20 competitor locations.
That's a huge statement about their, operational efficiency.
Yeah, I mean, and that really underscores the focus on integration and, maybe a more streamlined way of doing things.
Yeah. Yeah. Definitely. Now, early on, they really emphasized palliative care as one of their key service lines. So
Correct.
let's talk about SilverStone Hospice's approach to palliative care specifically. What does that look like?
So their approach to palliative care is fundamentally about improving the quality of life
Okay.
for people who are dealing with serious illnesses. So things like cancer, heart disease, dementia, and challenges like that. And it's important to note this isn't just about end-of-life care.
Okay.
This is about improving well-being at any stage
Got it.
of a serious illness.
And what are the core components then of those palliative care services that they offer?
So they emphasize personalized care delivered in the patient's home.
Okay.
And they focus a lot on alleviating those really distressing symptoms like pain, nausea, fatigue, and shortness of breath.
Okay.
And they also offer 24/7 support for
Nice.
both the patients and their families, which I think is really important.
Yeah, absolutely.
They also guide people through healthcare decisions,
Okay.
which can often be very complex.
Mhm.
And they actively work with insurance providers, including Medicaid and private insurance, to ensure that people can access the care that they need.
So they're kind of handling all of that back-end stuff as well.
They are, yeah.
Yeah. Now, it's really important to clarify the distinction between palliative care and hospice care because
Right.
those terms do get used interchangeably sometimes.
They do.
So how does SilverStone make that distinction? How do they differentiate between the two?
They're very clear that palliative care can be provided alongside curative treatments
Okay.
and really at any point during the course of a serious illness.
Got it.
Whereas hospice care is specifically for people who are in the final stages of life
Okay.
and typically with a prognosis of 6 months or less.
Okay.
And so the focus really shifts at that point from, trying to cure the illness to maximizing comfort and quality of life.
Yeah, making that transition.
Right.
Okay, now there's a blog post here that seems to be really key in this area.
Okay.
It's called Transforming Care: Palliative Solutions for Effective Pain Management.
Oh, yeah.
What are some of the pain management strategies that they highlight in that post?
Well, they outline a pretty comprehensive approach,
Yeah.
and medication management is at the heart of that. So they talk about the use of opioid medications
Okay.
for moderate to severe pain,
Right.
and then non-opioid medications for milder pain, and then also adjuvant medications like certain antidepressants or anticonvulsants to actually enhance pain relief.
Okay.
So they're really looking at, the whole picture there. And they also underscore the importance of physical therapy and rehabilitation
Hmm.
to improve mobility and reduce, musculoskeletal pain.
Okay.
Psychological support is another key element, including counseling, mental health and wellness programs, and even spiritual care, because they recognize that serious illness has a big emotional impact as well.
Yeah.
And finally, they talk about nutrition and hydration, making sure that patients are getting the support they need so their bodies can better cope with the pain.
Mm.
And they also stress the importance of education and communication with both patients and their families
Okay.
about, what pain management options are available to them.
So it's really like a patient-centered, holistic approach
It is.
to addressing all of those different needs.
Yeah.
Okay, so shifting gears now, let's focus specifically on hospice care.
Okay.
What is SilverStone Hospice's philosophy when it comes to hospice care?
Really, their philosophy revolves around making sure that people are comfortable,
Okay.
preserving their dignity, and maximizing their quality of life as they approach the end of their lives.
Okay.
And they even emphasize this idea of the little things,
Hmm.
which to me really suggests that they're committed to providing this compassionate and personalized care
Right.
that is really attentive to, the needs and the preferences of each individual patient.
Really focusing on the details.
Oh.
Yeah, okay. So let's say, someone's listening to this and they're thinking, well, this sounds like something that might be right for me or for a loved one.
Okay.
What are the eligibility requirements for SilverStone's hospice care?
Well, the main criteria is that you have to have a diagnosis of a terminal illness
Okay.
with a physician's prognosis that says you have a life expectancy of 6 months or less
Okay.
if the disease follows its natural course.
Okay.
And so common conditions that might qualify include things like advanced cancer, heart failure,
Right.
COPD, end-stage liver or kidney failure, and then advanced dementia or Alzheimer's disease.
Okay.
And importantly, the patient's health has to be showing a decline even though they're receiving medical treatment.
Yeah.
And they need to have made a decision to prioritize comfort and quality of life over pursuing any more, curative treatments.
Okay.
But of course, palliative treatments that are designed to relieve symptoms, those will continue.
Got it. So it's really about shifting that focus.
It is.
Yeah. Are there any other kind of specific signs that our listeners should be aware of that might suggest it's the right time to start thinking about hospice care?
Yeah, there are a few things. If someone is experiencing frequent hospitalizations,
Okay.
that might be a sign that, focusing on comfort care at home could be a better option.
Right.
And also a decline in functional abilities.
Okay.
Things like basic activities of daily living, being able to eat, dress yourself, move around.
Mm-hmm.
If those things are becoming difficult, that's another really important sign.
Okay.
And then lastly, if symptoms like pain or difficulty breathing or nausea are becoming really difficult to manage despite medical interventions,
Great.
that's definitely a good time to, start exploring hospice care options.
Right. Right. It's about recognizing when that shift needs to happen.
Exactly.
Yes. SilverStone also has this program called No One Dies Alone.
Yeah.
So tell us a little bit about that. It seems like they go above and beyond kind of the normal scope of hospice care with that program.
They do. They highlight this as a program that provides care and support above, the standard regulatory requirements. And it seems like they're very committed to making sure that people have companionship and compassionate care, especially during those final moments,
Wow.
whether or not family members are present.
That's really going the extra mile.
It is, yeah.
So, obviously running a healthcare organization, especially in this sector, comes with its own set of challenges.
Right.
What are some of the issues that SilverStone Health is facing right now, just kind of industry-wide?
Well, one of the main challenges is the rising cost of labor within the healthcare market
Okay.
and the intense competition for clinical professionals, especially nurses.
Yeah, everyone's trying to hire nurses right now.
Right. And there was an article from October 2024 that talked about how hospice organizations are trying to find creative solutions for both hiring and retaining staff.
Right, it's not just about getting them in the door, it's about keeping them.
Exactly.
So how does SilverStone and Alfonso Montiel specifically, how does he view this challenge of salaries going up and up and up.
He actually has a very interesting perspective on that.
Okay.
While he acknowledges that competitive compensation is a reality,
Right.
he suggests that just focusing on salary alone can sometimes actually be counterproductive
Interesting.
because it can hinder the development of a really strong collaborative organizational culture,
Okay.
and it might even lead to higher employee turnover in the long run.
So people just kind of bouncing around for an extra couple of bucks.
Yes.
Yeah.
And not really getting bought into the mission.
And the culture of the place.
Exactly.
Yeah. Okay. So what are they doing about it then? What are some of the things that SilverStone is implementing to try to address these staffing challenges?
Well, they're focusing on more than just, money.
Right.
They're trying to communicate the inherent value and the positive impact of their team's work
Okay.
and emphasize, the deeply rewarding nature of a career in hospice and palliative care.
Yeah. I can see how that would be really appealing.
Yeah, and Montiel uses this really interesting analogy. He says, every life is like a plane.
Okay.
We're all going to land.
Mm-hmm.
And what we can do with hospice and palliative care is instead of crashing, we help it glide.
Oh, wow.
So I thought that was really beautiful.
Yeah, that's a really powerful way to put it.
And they're actually developing marketing materials
Okay.
that are aimed at their own team members.
So internal marketing as
Yeah,
well.
exactly.
Yeah.
To reinforce that sense of purpose and highlight the meaningful stories,
Yeah.
of the care that they're providing.
Okay.
Yeah, and they understand that you have to find a balance between, attracting new people and retaining your current staff.
Right.
That's really important.
Absolutely. Are there any other kind of operational challenges that they've addressed proactively?
Yeah,
Yeah.
absolutely. So they recognize how important it is to have a really streamlined and proactive approach to patient referrals.
Okay.
And they've set this really ambitious goal of a 5-minute turnaround time for processing new referrals.
That's fast.
Yeah. So to achieve that, they've invested a lot in building this robust back office infrastructure
Yeah.
with enough staff to handle the high volume of calls and inquiries.
Mm-hmm.
And they've also really focused their marketing on education,
Oh,
positioning SilverStone as a valuable resource, not only for, the people in the community that they serve, but also for clinicians
okay.
in other healthcare settings.
So really casting a wide net there.
They are, and Montiel has even suggested that marketing teams be rebranded as patient advocates,
Oh, wow.
emphasizing that their primary role is to educate first
Interesting.
and then be caregivers second.
I like that, yeah.
Yeah.
Putting the education piece front and center.
Mm-hmm.
So it sounds like, they're really trying to build something that is sustainable and impactful.
Right.
And they're doing that by prioritizing, real value, operational efficiency, and community education.
Yeah.
So has this approach earned them any kind of recognition from outside the company?
Alfonso Montiel was actually named an Entrepreneur of the Year 2024 Southwest Award finalist
Wow.
by EY.
That's a pretty big deal.
It is. It's a huge recognition of his leadership
Yeah.
and, the impact that SilverStone Health is having.
Yeah. And that award in particular is all about entrepreneurs who are disrupting markets and revolutionizing industries.
Right.
So that speaks to the fact that they're doing something really big.
Yeah.
So was there anything specific that they said about him and why he was recognized?
Yeah, they specifically talked about, his journey from being a hospice volunteer
Right.
to identifying the cracks in the at-home healthcare system and his mission to make sure that no one has to go through this journey alone,
Okay.
especially the people who are most vulnerable.
Uh-huh.
And they also highlighted his vision for this integrated system, that provides this continuous uninterrupted care
Right.
and simplifies the complexities of both the healthcare and the insurance systems.
Simplifying things is huge, right?
It is, yeah.
Yeah.
And it seems like the accolades don't stop there.
Okay.
SilverStone Health actually received the 2025 Innovation Award for Healthcare and Biotech,
Wow.
which recognized their work in transforming post-acute care in the home setting.
That's fantastic.
And they also earned palliative hospice heart failure certification from the American Heart Association,
Okay.
which means they're committed to following these, gold standard evidence-based practices for heart failure patients.
So they're really checking all the boxes here.
They are.
Yeah.
Yeah.
Well, as we wrap up this deep dive,
Yeah.
what would you say are the key takeaways here? What are the things that people should really remember from our discussion of SilverStone Health?
So we've seen a company that has experienced really rapid growth driven by, this leader who has a very clear vision for a more compassionate and integrated approach to healthcare.
Right.
And they've built this really comprehensive suite of services, ranging from palliative care to hospice. And they're doing it all with the goal of providing this seamless and holistic support to both patients and their families.
Yeah, meeting all of those needs.
Exactly. And they're tackling some of these big industry-wide problems, especially when it comes to staffing, with these really innovative strategies that go beyond, just throwing money at the problem.
Right.
And they're focused on efficiency. And they're also really committed to becoming an educational resource in their community.
Okay.
So all the recognition that they're getting shows that they're making a really big impact.
Yeah, absolutely. And for you, the listener, you came here to learn efficiently and thoroughly, and I hope that this deep dive has given you some of those aha moments.
Right.
Where you've really understood how this model has evolved.
Yeah.
And, what are some of the factors that have contributed to its success?
Yeah, absolutely. And that brings us to a final thought for you to consider. As you think about SilverStone Health's journey, what are the bigger implications for how we think about and deliver care to people who are facing serious illnesses or the end of life, especially when we consider that more and more people want healthcare services delivered in their homes.
Right.
And we see this really clear need for a more interconnected healthcare system.
Yeah.
What new approaches do we need to be thinking about to really bridge those gaps in care that Alfonso Montiel identified way back when?
It's a question for all of us.
It is. Yeah, a lot to think about.